also called malignancy, is an abnormal growth of cells. There are more than 100 types of cancer, including breast cancer, skin cancer, lung, colon, prostate cancer, and lymphoma. More than 10 million people around the world die each year from cancer. Experts project cancer deaths to rise to 30 million by 2030 if we do not act now. World Cancer Day aims to save millions of preventable deaths each year by raising awareness and education about cancer. At Medicircle, we are conducting an exclusive interview series on the occasion of World Cancer Day, showcasing eminent oncologists over a discussion to bring awareness about it. It's the cancer, its treatments, its myth which are related to it. So this is all the talk about, and I'm your host, Smita Sahai Kumar from Medicircle. Today, our guest is Dr. Pushkal Dwivedi. Dr. Pushkal is one of the well-known and recognized consultant oncologists, hemato-oncologist in Bilaspur. He's an experience of 13 years in this field. Dr. Pushkal practices at Ramkrishna Care Hospital in Mathpurena, Raipur, and Arogya Hospital, Bilaspur. He's a member of Indian Co-operative of Oncology Network, American Society of Hematology, American Society of Clinical Oncology, European Society for Medical Oncology, European Hematology Association, Mumbai Hematology Group, Indian Association for Palliative Care, and Indian Medical Association. Hi, Dr. Pushkal. Welcome to World
Hi.
at Medicircle.
Yeah, sure. Thanks for providing this opportunity to share my thoughts.
Sure. So, Dr. Pushkal, to begin with, there are three most common types of cancers in India. They are breast, cervical, and oral cancers. So we would like to know from you that are they curable, and if yes, how?
Yeah. So considering the breast and cervical cancer is it's not mainly, so primarily it's a disease of the females. Cervical, of course, it's 100% female cancer, and the breast almost 90 to 95% breast cancer patients are female. Males hardly around 5 to 10% of the overall population of the breast cancer patient. And cervical means that head and neck cancer is more common problem in the male. So we'll discuss one by one about all those things. So what we have seen that around two decades back, it was the cervical cancer which was the number one. Now within 2 years, the change is that cervical cancer is number two and the breast cancer is number one. The reason is probably that the lifestyle we are adopting, that Western lifestyle, that is the, I think, Western lifestyle means that late marriages and uh, late age of the first baby, and means conceiving, that woman conceiving at the later age, and many times they don't even breastfeed that child. And of course that lifestyle means stress and dietary pattern, all those things affect the cause for the rising incidence of breast cancer. While at the same time, because of the better hygiene and vaccination, of course vaccination plays very well role in reducing the incidence of the cervical cancer. We know cervical cancer is mainly driven by the virus called HPV, human papilloma virus. And now as we have vaccines against the human papilloma virus, HPV, against the HPV, so the cervical cancer incidence has gone drastically down. And because of vaccination, we have controlled this cervical cancer to large extent. But of course the breast cancer is rising, and when it comes to the head and neck cancer or oral cancer, what we say, it is rising again. The main reason is that tobacco consumption is the most important cause for the oral cavity cancer, head and neck cancer, especially among the males. It is common in females also, but males, if I see 100 100 head and neck cancer or oral cancer patient, all out of the 190 patients are male, females are hardly 10. and it is across the India the same similar pattern. And out of the 90, almost 85 to 85, 80 to 85% patient, they consume tobacco in the some form, whether it's in the gutka or pan parag or pan masala or bidi or smoking, whether it is chewing or smoking or any other way, but somehow they consume tobacco. And if somebody is consuming tobacco and apart from that he is consuming alcohol and also, then it is synergistic effect, what we called adding effect of the carcinogenesis. Means both the tobacco and alcohol both are carcinogenic in oral cavity malignancy. And if somebody is having addiction of both these things, then the risk is multiplied many times. So that is the thing we should discuss with our population. And fortunately, all these three cancer, whether it is the breast cancer or cervical cancer or oral cavity cancer, all these cancer are mainly preventable and can be detected very early stage. That as you must be knowing that the chances of getting successful treatment is depend on in which stage we are picking the patient. Means
Okay.
if we are picking the patient in the early stage, stage 1, stage 2, then the chances of cure is relatively very high. While at the same time, if the we are picking the patient at the advanced stage, then the chances of cure is relatively less. So fortunately, all the three cancer, whether it is breast cancer or oral cavity cancer or cervical cancer, we have excellent screening programs through which we can pick up the patient in very early stage.
Okay.
Only thing that we have to create awareness so people know about it, and people should aware that which are the subgroup who are considered as high risk group.
Okay.
And especially the high risk group should reach to the doctors for their regular screening to know the status of the such kind of illness.
Okay. So, doctor, we have, like, with the passing years, there has been an increase in the number of cancer cases, as you just said about breast cancer. Like, according to the study, India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. So, what are the reasons and how they can be controlled?
Yeah, at that means as I discussed, that it is the mainly lifestyle. If you see around 3 to 4 decade back, the India's cancer was not major problem for us. It was primarily considered disease of the Western population, that so-called developed country.
Mhm.
Now, what happened due to the way we are adopting the Western lifestyle, that is the probably I think the reason why we are getting more and more number of cancer. Apart from that, the lifestyle is one factor. Apart from that, the pollution and addiction, all those things multiply, means that we are polluting our air, we are polluting our soil, we are polluting our water, and all those things are ultimately what the amount of pesticides we use in our crops. All those things somehow they become part of our food chain, and through our foods and water, somehow they come into our daily life, daily daily routine. So means it is, we have to understand that cancer is multifactorial phenomena, and it is not one thing. Means it sometimes we come across the patient where there is no history of addiction. In spite of that, they develop cancer. So it's not the only the addiction which is plays role. It is apart from addiction, there is other factors like pollution is very important factor. And if when I say pollution, then there are so many parameters: air pollution, water pollution, soil pollution,
Okay.
and all those things contribute.
One very common question, I mean, people might have been asking you again and again, like there are a lot of myths associated with this disease. One of them, I don't know whether it's a myth or truth, would like to, I mean, ask you, like a lot of people think that cancer is genetic. So how true is this?
Yeah, it is actually cancer is a it is partly true, no doubt about it.
Okay.
And every cancer is different. Since we cannot pass a statement which applies on each and every cancer.
Okay.
But if somebody asks the genetic association of the cancer, then again we have to ask, you are talking about which cancer, or you about asking about the which cancer. So if we discussed about every cancer, like breast, of course the breast cancer there is genetic potential. If mother has breast cancer or ovarian cancer, then the daughter has certainly high risk. And it is again the first degree relative and second degree relative, and number of family members are positive to breast cancer, the daughter has increased risk. But again the same time, the head and neck cancer or oral cancer, there is as such no such evidence for the genetic predisposition. At the same time, for the cervical cancer also, as such, best my knowledge, there is no such genetic association
Okay.
for the cervical cancer. But of course, the breast cancer, there is evidence. There is more than enough evidence to say that there is a genetic predisposition for the breast cancer malignancy. And if somebody has history of the breast cancer or ovarian cancer, there is something called breast ovary syndrome. So if somebody has history of breast cancer or ovarian cancer in the family, in the first degree relative or second degree relative, then she should be cautious, especially if somebody develop cancer below 40 year or below 50 year. If somebody develop cancer after 40 year or 50 year, then the risk of genetic predisposition gradually less. But if somebody develop below 40 year or below 50 year, then we should be very careful, especially in the breast cancer patient, for the genetic predisposition.
Okay.
We have tests now to know exactly the risk of these to know the stratify the risk of this genetic predisposition for the breast cancer,
Okay.
that your doctor or your oncologist can guide you. But of course we should accept it.
Sure. So thank you so much, Dr. Pushkal, for sharing this relevant information with our viewers about cancer. As a dedicated media platform for healthcare, we are trying to raise awareness and educate more and more people through our initiatives, because we are seeing rising numbers, especially for breast cancer. And as we have been discussing all through these videos, that early detection and screening is really, really good for the cancer patients, because it actually increases the life expectancy of the patient, and also the to combat this cancer at an earlier stage would be much, much more easier. Also, as you said, pollution being one of the contributing factors causing cancer is really a cause of concern. So we should be stopping and taking care of all types of pollutions happening in our environment. So once again, Dr. Pushkal, thanks for joining and giving us your precious time.
Thanks. Thanks.